all you need to know about a semen analysis and andrologist's perspective. So, the first investigation that we always ask when evaluating a couple with infertility from an andrologist's perspective for a man is the semen analysis. So, a semen analysis, the abstinence period, the standard advice that we give is 2 to 5 days of abstinence. Many guidelines give a slightly different variation of these 2 to 5 days period. But I, being a panel member in the male infertility guidelines of Urological Society of India, so we have stated that 2 to 5 days abstinence is good enough for a good semen analysis report. Usually a good room is provided in the hospital or in the fertility center for the man to masturbate and give the semen sample. And we sadly see sometimes that some of the centers or some of the small labs where the patient is sent to a toilet and he's been told to ejaculate, masturbate and masturbate, ejaculate and give the semen sample. So I think that's not a good thing, and any man, it's quite difficult to just go to a toilet and masturbate and give the semen sample. And mind you, many of these patients are already under significant stress and anxiety because of male infertility. Sending them to a toilet definitely is not a good idea. Other thing is, many patients, they ask me, Doc, I cannot ejaculate in the hospital, but I can comfortably ejaculate in a home setting. So can I go home, ejaculate and bring the sample to the hospital for its analysis? My personal suggestion is not to do it, because there will be a breach in so many things before it reaches the hospital. So suppose if you really want to do it, the best thing would be your wife or your partner should be at the hospital. So they should have registered your name and the sample bottle is collected, which you can take home, or any nearby hotel you can book around the hospital, which is less than 1 kilometer radius, and then you ejaculate there and bring the sample to the hospital. Make sure you don't put it in any ice pack. Basically keep it as close as to the body, which means you can comfortably keep it in the trouser pockets and you can get it to the hospital. And the most important thing is, from the time that you ejaculate, the sample should reach the lab within 30 minutes. Otherwise, there can be significant variations, changes. And also another important aspect is that from the time of ejaculation and the moment that enters the lab, that semen has to be analyzed within 1 hour. So otherwise, the motility of the sperms will reduce and there will be a false report saying that there is a poor motility and so on. The 2 to 5 days abstinence, why it's important is, if you give it before 2 days, the volume of the semen may be less, because body needs some time to produce the semen and the sperms. So the sperm counts may be less and the volume may be less if you give it before 2 days. And if you give it after 5 days, the volume and the counts may be good, but the motility, which is the movement of the sperms, may be very less. And the 4 important things, there are so many things that we see in a semen analysis, but the 4 important things that we see is the volume, which will be in ml, how much ml, usually it's around 1.5 to 2 ml. The second thing we see is the concentration of the sperms, which means the number of sperms that are there in 1 ml of the semen. So according to the WHO, around 15 million per ml sperm concentration is considered to be normal. And the third thing that we see is the motility. In motility, there is progressive motility and non-progressive motility. For us, what is important is the progressive motility, and that should be around 32%. So if the motility is good, the chances of a normal conception is higher, because the sperms have good capacity to travel from the place they are deposited, that is during the intercourse, which is usually around the vagina cervix. From there, if the motility is good, they usually they reach the egg soon, and then they help in fertilization of the egg. The last thing that we see is the morphology. The most fertility centers follow the strict Kruger's criteria, and the normal value is 4%. So the morphology is 4% is the normal. But if you do it in some of the non-fertility centers, you may sometimes get a report as high as 80 to 90% as normal, which is not the ideal way of reporting it. And another suggestion of mine is always please do a semen analysis in a fertility center or in an andrology center. See, you can do the blood and urine test in any of the smallest labs that is available, but for the semen analysis, please do it in a fertility center, and the reports are best reported if it is done by an embryologist or an andrology lab technician. So that's in brief about what you all should know about semen analysis.